Today, we're going to talk about the thyroid health and how it is connected to the gut. Some of you I recognize, and I'm glad to see you here. And I have new faces and new people. So if you're not familiar, if you don't know who I am or you're not familiar with what I do, just just want to let you know my name is Noor Zibde. Well, I have my name in the first slide, but not in here. So I'm a functional dietitian and nutritionist. I have a bachelor's degree in nutrition and a master's degree. Went to Virginia Tech, James Madison. And then I've started practicing since 2012, been a dietitian since 2008. And really, my personal journey took me on functional medicine training and started seeing people who are dealing with a lot of digestive and autoimmune conditions. And it really pushed me and forced me to learn how to do this and to seek special training because there are a lot of people suffering. A lot of people are not getting the answers that they need and that they're looking for, and they're not always able to connect the dots, and not all doctors are doing that for them. And so a lot of people are like you are trying to do it to get on your own and put the pieces together. So I really wanted to offer this as a way to have really the opportunity to talk about thyroid health, because it's a big topic. And a lot of times, even with my friends, we'd be having a conversation and somebody would tell me, oh, my thyroid is fine. And I'm like, wait, is it really fine? Like, I want to have the opportunity to share that. So if you have a friend or a colleague or a family member who also needs to hear this, afterwards, I will try to put the recording up as well so that more people can listen to it and benefit as well. So just a disclaimer for today's talk, this is for educational purposes. I am not treating you. I'm not your doctor. And you may still need to take your thyroid medication. I think a lot of times people who are looking at ways to heal naturally and with diet and lifestyle and food and supplements, we have like an immediate reaction when we hear medications. Sometimes actually for the thyroid gland, the medications are important. Many times they're necessary. And sometimes, some doctors are giving them temporarily to ease the pressure on the thyroid gland and just let it recover and rest a little bit. And that's often something that happens with autoimmune thyroid conditions. So you want to discuss your medication options with your doctor. Don't stop a medication based on our conversation today. And I do help my patients with the gut portion. So with food sensitivities, supplementing with certain nutrients, addressing gut imbalances. And as you will see at the end of the talk, how this is important to the thyroid health. So that's just keep in mind that there's room for medication and that you still have to work with your doctor. So why is the thyroid gland important? So the thyroid gland is going to produce 4 types of thyroid hormones. We're mostly going to talk about T3 and T4 because these are the most predominant ones. T3 is the active hormone. So that's the hormone that is going to turn on the genes in cells. So what happens is you've got the T3, it's going to go to every cell in your body, and it will tell the genes there, the genetic component, hey, make some proteins to produce energy. And so it is going to help produce and manage energy to meet your daily needs and your daily challenges. So you can get up and go to work and exercise and take care of your kids and cook your food and so forth. So you do need the active hormone, and you need it to make it to the cells. And then you need a loud message to be heard, because if it's not, then we're not going to have this hormone that is not going to do what it's supposed to do and do its job. And then when it is heard, it is going to produce more enzymes and make more receptors, so more of it can turn on the cells and make more energy in the power plants in the cells. So if you've heard of the mitochondria, these are the little particles in the cells that produce energy. So they are going to wait for that message from T3 in order to produce energy. And then we need antioxidants to cool off the furnace, right? We produce a lot of energy, and that can create damage in the cells. And so we need antioxidants to calm that down. And this will come up next in our conversation. We know that many systems and organs are affected by the thyroid gland. And of course, if you have thyroid issues, you know that it is going to affect many things: breathing, heart rate, ability to control body temperature, digestion, as well to muscle strength and menstruation and menstrual cycle hormones, and also cholesterol levels. And I'll tell you here quickly is if you have high cholesterol levels, even when you eat healthy and you do all the right things that you're supposed to be doing for your cholesterol, but the numbers are still high, that could be an indication of a sluggish thyroid. It's not processing the cholesterol pathways properly. Let's talk about basics and introduction, because I think these terms I will refer to, and I want to make sure that hopefully with the pictures that I created, they are more clear. You have your thyroid gland, which is going to produce 90% T4 and 10% T3. So most of the thyroid hormone production is going to be T4. T4 is not active. The body needs to convert T4 to T3 to make it active. And this is really important. The body does not want the furnaces to be working all the time. It wants to create a buffer. It wants to be in control of how much T3 is being made. And so it's going to make more T4, and then it will tell us, that it will tell all the other parts of the body that are responsible for conversion of T4 to T3 how much to make. And then T3, it's going to have a receptor on the cells, and the T3 will activate these cells in order to produce and make more energy. So this is the basic one, right? Like, it's simple. What could go wrong in this? What tells the body, how is the message communicated to the body to produce more thyroid hormones? So here's the thyroid gland, and it's going to make T4 to T3 and convert it to the active T3. And then the TSH, so then it goes back, that hypothalamus, so that's the little gland in the brain, is going to produce thyroid releasing hormone, which then tells the pituitary gland to make TSH, which is thyroid stimulating hormone. And the thyroid stimulating hormone has, there are receptors for TSH on the thyroid gland, and that is going to tell the thyroid gland to make the hormones. And then if we have too much of them, if we have enough, then it just, the message goes back and say, hey, I've got enough, stop the process, don't make more. And that's how the body can control it. Now, if we have low T4 and T3, the body is going to sense that, the hypothalamus and the pituitary, and then to respond to that, they will produce more TSH. So more TSH is going to tell the thyroid gland, hey, I'm short, I'm running behind, make more thyroid. So this is what we call the hypothalamic pituitary thyroid axis. Now there is hypothalamic pituitary adrenal axis, by the way. And so these get connected, but this is what we're talking about for the thyroid for our talk. So with that, this is going to be, sensing the low T3 and low T4. What does it feel like to have low T3 or low thyroid function or low thyroid output? T3, T4, we'll go into the more details. You'll feel tired, you'll feel sluggish, brain fog, difficulty concentrating. You may feel down and having depressed mood. You're cold. So if you're the only one in the room who's cold, you always have to take a jacket with you everywhere you go when everybody's feeling normal. If you are constipated, if you have bloating as well too, if you're not sweating, muscle stiffness and weakness, you are gaining weight, or you have a very, very hard time losing weight, dry and pale skin, reflexes, that Achilles tendon reflexes are sluggish, you are losing hair, or your hair is thinning, or it looks brittle. And then also hair at the third part of the eyebrow, the outer one, it can, if it's thinning, that could be a sign of thyroid problems. Same thing as the nails and dull eyes and dry. And so the body is really slowing down everything. And then we see that all across the body. Now, on the opposite side, when it is hyperthyroid, it is producing a lot of T4, T3, there's a lot of it. Then we have heart palpitations, trembling, increased heart rate and pulse, anxiety, nervousness, emotional distress. You can't sleep, you're sweating a lot, and then you're losing a lot of weight and you have a difficulty gaining weight. So so sometimes that's a stereotypical also, just to keep that in mind. A lot of times people feel like hypothyroidism is always associated with overweight and obesity, and hyper is always associated with being underweight or thin. And so that's when a lot of people who are in a healthy weight range, they have a healthy BMI, they look like they're good with their weight, but they actually are slow in their thyroid function. And they may have all the other symptoms of thinning hair, fatigue, aches and pains, low mood. But then the doctors will say, oh, well, you're at a normal weight, you're not overweight, so I don't think it's hypothyroidism. And unfortunately, a lot of people get missed and they miss the diagnosis and they're being overlooked. And that's unfortunate. So while the weight gain and weight loss, typically weight gain with hypo, weight loss with hyper, it's not always, we can see exceptions. What are the doctors using to assess thyroid health? So back to this picture, right? We need the TSH to tell the thyroid to produce enough hormones. So many times when you go to your doctor and you're sharing how you're feeling with them, or they're doing part of an annual assessment, typically they are only looking at TSH, thyroid stimulating hormone. Sometimes they order T4. Now, if your doctor is ordering more than this, then you're really lucky and you have a good doctor who's looking at it from a comprehensive perspective. Now, there could be insurance policies that dictate what gets covered by insurance. And I understand some patients and doctors are also trying to be mindful of what's allowed on your insurance. But unfortunately, that leaves people without true knowledge and understanding of their thyroid gland. So what happens is TSH is done. And then when there isn't enough T3 and T4, the body will produce more TSH to send that signal. And we see high TSH. So high TSH is usually associated with low thyroid function, low T3, low T4. So if it comes back within the normal range, the doctor will say, you're fine, your thyroid number is fine, or your thyroid is okay. And if they have done a T4, it's still not telling us about T3. So the problem when we're only depending on these two things is that one or two labs are not telling us, do we have enough of the active T3? So that's the one in purple. That's the one we actually need to activate the cells. Now, is the T3, is the message being heard and seen? Is it making it to the cells and turning on the cells? Are the hypothalamus and pituitary gland healthy? What if there are things happening in here and they're not producing TSH? So your TSH is low and within normal range, but you have a problem with the pituitary and hypothalamus. Is the body shutting down thyroid production on purpose? So maybe that would be reflected in TSH, maybe not, but maybe the body does not want to make too much T3 because it doesn't feel safe. And I will share more about this. It wants to preserve energy. And is the thyroid under autoimmune attack? TSH doesn't really tell us anything about autoimmunity. And we know this is important because autoimmunity is on the rise, and I'll be talking about this more. So when you are told you are fine, or your doctor does a thyroid panel for you, ask for the lab. And I'm going to share more with you to talk about what you need to look for when you look at your labs. So again, is the hormone being heard, right? So here is the receptor. Is the T3 attaching to the receptor on the cells? And then, so do we have enough T3? And then is the body making something we call reverse T3? So reverse T3 is one of the ways the body is trying to preserve energy. If it doesn't feel safe, it feels like there is stress, trauma, infections, lack of antioxidants, or anything that is not optimal, where the body decides that it's not a good time to activate all this energy making process, it is going to make more of the reverse T3. So it's a mirror image. It's going to sit at the receptor instead of T3, and it's going to block T3 activity. And that's why reverse T3 is something that I really like to get when I'm working with my patients, because it gives me a big picture of inflammation and stress in the body. We talked a little bit here. We know that toxins, inflammation, stress, trauma, pro-inflammatory cytokines. A lot of people have heard of the word cytokines after COVID. So these are chemicals that the immune system will produce in order to fight infections and pathogens. But also these cytokines will fight food in case of food sensitivities, and they will fight your own cells if you have autoimmunity. Mold, Lyme will affect the hypothalamus and pituitary. And then those TS receptors on the cells, they are going to be affected by pesticides and toxins in our environment as well too. So it is a bigger picture, and it is not just TSH. So let's get familiar with a few more terms I keep adding to this picture that I shared in the beginning. So here's the process, and here's the reverse T3, which is the mirror image that blocks the receptor. And you see here how we are making TRH and TSH. Now, a few terms are because I'm going to talk about them. So the thyroid, how does it even make thyroid hormone? So it's going to grab iodide in food, and we have an enzyme called thyroid peroxidase, TPO. So the TPO is going to take iodide and oxidize it to iodine, and then it's going to take that iodine and attach it to tyrosine. And tyrosine is an amino acid, and that tyrosine is not on its own. That's sitting on a protein called thyroglobulin. So there's this protein, thyroglobulin, that has a bunch of amino acids, a bunch of tyrosine amino acids, and this enzyme is going to take these all together and make T4 hormone. So thyroid peroxidase is a very, very important enzyme. And thyroglobulin is also another important protein that we will talk about in autoimmunity. And then you have thyroxine binding globulin. So this is, think of it as the transport vehicle. This is going to take the thyroid hormones and spread them out and transport them to other parts of the body. And actually, when you have a lot of thyroxine binding globulin, you're going to have a lot of thyroid attached to it. And so it may not be available to the cells. And then we have the T4 to T3 conversion that can happen in the liver, in the muscles, and the intestine as well too. So as you can see, the process just, we're adding more to it, and these are all the nuances and very important to understand fully how does the thyroid gland function. So what are autoimmune issues? And it's important to talk about them because they are very, very common. When the thyroid gland gets attacked by the immune system and the immune cells are going to attack TPO, thyroid peroxidase enzyme. They're going to attack thyroglobulin protein, and then they are going possibly to also attack TSH receptor. So that's the receptor of TSH on the thyroid gland. The common autoimmune conditions that we see are Hashimoto's, thyroiditis, and Graves' disease. So in general, we see with Hashimoto's more TPO, like anti-TPO. So the body will produce antibodies that fight TPO, but they will also produce antibodies against thyroglobulin. So it's really important to have both of those antibodies measured, tracked for the autoimmune process. Now, with Graves' disease, we tend to see more autoimmune attack on TSH receptor, but you can also have high TPO and high thyroglobulin. So it is important to, at least when we are looking for autoimmune issues, to look at both anti-TPO and anti-thyroglobulin, not just one of them, because sometimes this will be okay, but the thyroglobulin will not. And then you miss knowing whether you have an autoimmune condition or not. What is autoimmune Hashimoto's thyroiditis? Again, it's an autoimmune condition where the immune cells now are lost and confused. With autoimmunity, I always say it's like the army that lost the general. It does not know who to attack, it does not know who to protect, and it's like haphazardly, like randomly fighting things, including self. And also, so that's autoimmunity. And then we see with autoimmunity, we see often immune response to everything, to food, to the environment, to dust, pollen, and other things as well. So with Hashimoto's, women are at higher risk of developing Hashimoto's. It's a very high range, a very big percent, like up to 90% of hypothyroidism is related to Hashimoto's, and appears between the ages of 30 to 50. Runs in families. So if you have a mom or a sibling or an aunt or a grandmother, now some of us, we don't know what our grandparents had. We just know like they took this organ out or she had this issue, but we know it runs in families. So if you have a family member with Hashimoto's, you are at higher risk, unfortunately. And we know that autoimmunity comes in packages. So unfortunately, once you have an autoimmune condition, you are at a higher risk of developing another. So that means celiac disease, rheumatoid arthritis, lupus type 1 diabetes, and other autoimmune conditions. Now, I want to make sure that it's not a doom and gloom. It doesn't mean that you will have all these autoimmune issues, but if we don't really shift the focus from what happens with autoimmunity is that your GI doctor is going to focus on the celiac disease and the rheumatologist on the RA, and then the endocrinologist on diabetes and Hashimoto's. But we're not looking at why is the immune system attacking all these organs. We're just tending to the branches when we are given medications or treatment for that specific organ. But what about how it all started? And that's why power of the gut and fixing the gut is really, really important for autoimmune issues. So what are the symptoms of Hashimoto's? So we'll say that the body fluctuates between the hypo, the slow and sluggish, and hyper, the fast and hyperactive, and anxiety. And I think, what happens, part of it is that the attack happens, and then the thyroid is not pumping out enough hormones. And then, so you'll see hypo, and then it tries to compensate, and then you'll see more hyper. So it's going to be a confusing picture when it comes to symptoms. You're going to be going into two extremes, very likely. And I find with my patients with Hashimoto's is that we have just more severe symptoms. I still remember one of my first Hashimoto's patients. She was a young mom who was having a hard time going up and down the stairs to carry her kids. She had two little ones, and she was so fatigued, so lethargic. Unfortunately, her doctors never tested her for thyroid autoimmune labs, and I pushed her to do it. And then it makes me feel sad that this could have been diagnosed, this could have been screened for before. And so we worked on the diet, and we worked on the gut, and she did take a medication. So I just want to also point out that sometimes you do need it in order to slow down the attack on the immune attack on the thyroid, and just give the thyroid a little bit of a break. So we see a lot more symptoms when it comes to Hashimoto's. I see a lot of aches and pains. Another patient of mine with Hashimoto's for 30 years, and she had a car accident, and she was told that she will always have to live with her pain. And unfortunately, none of her doctors told her that she can do something about the diet and the gut. So once we fixed that, she was able to move around and wake up and not have to deal with the pain every single day. So we'll just see the symptoms are really more severe when it comes to Hashimoto's. So what causes autoimmunity? This is the million-dollar question. And we're seeing autoimmune conditions on the rise. It's the perfect storm that creates an autoimmune activation, sort of. So we have genetic predisposition. If you have a condition, if a family member has an autoimmune condition, you may have a genetic predisposition. And there are genetic tests if you want to go further with that investigation. Then we have diet and food, and the nutrients, and are you feeding your microbiome and getting your body enough antioxidants and things like that. And then we know intestinal permeability, which is leaky gut and having infections in the gut. And a lot of studies find that certain types of bacteria in the gut, once they pass through the gut lining, they activate autoimmune attack. That has been published for a while. It's not very new news, but it was like interesting when the first studies came, and the doctors were, the number one conclusion from the article was like, we need to find antibiotics to kill these bacteria. And, while this could be a valid option, well, how about we actually support the good bacteria? How about we promote healthy bacteria, intestinal gut? Let's look at the leakiness of the gut, what's causing that, and what to do about it from diet, lifestyle perspective as well too. And then we can resort to antibiotics if it's absolutely needed. And antibiotics sometimes are often contraindicated, may not be helpful for every single inflammatory microbe or bacteria that could trigger autoimmunity. And then we have the environment. We have a toxic load. And I'll tell you, I won't go into a lot of details on this because this can be very, very overwhelming, but there are plastics and heavy metals, pesticides, and even when we get organic, it definitely helps, but it's still in the air, in the water, and I'll touch up a little bit on it, but this is another talk, and we have to think of it as a slow progress and small changes that we make over time, because it can get very, very overwhelming to think of the environment. So this is important. This is the testing for thyroid. Conventional medicine is really like, or when you are doing a screening for thyroid, if you are told that you're fine, many times they're testing for TSH. The conventional range, like what you will find the test, and to get those, I have few references from some of the trainings that I've done and my mentors, but I actually pulled up some of my old labs to see what Quest and LabCorp would have in their ranges. So conventional will tell you anything between 0.5 to 5.5 is normal. Remember, high TSH means that your thyroid, the body is not sensing T3 and T4. Now, when we come to functional ranges or optimal ranges, we find that people are doing better if TSH is up to 2 or 2.5 maximum. And this range, what 5.45 or 4.5 is actually pretty high. And especially for pregnant women, they are very at a much tighter range, because we know that a little bit an increase of TSH will actually affect the baby and cause miscarriages or problems in pregnancy. So this is where we want to aim. So if you have labs, grab those and take a look at what your labs say. And if anybody's watching the recording later, pause this and go get your labs and take a look. You want to be in a tighter range. Now, free T4, this is what is conventional, and here's the optimal. So a little bit about like also labs, like where do they come up with these ranges? So you might find that different labs will give you different ranges, and that's because they lump all the data that they get, and they do that bell curve. And if most people are in the middle, then that's how they create the middle. They'll remove the top percent and the bottom percent, and that's it. So that's why you'll see ranges. But if everybody's sick, if everybody is going undiagnosed without issues, like we don't always know, like if you're at the both ends of the range, what does that mean? So if your free T4 is 0.9 and you're told that it's fine, but that's kind of on the low end. So that's something to think about. Same thing for T3, free T3. Optimal, we wanted 3 to 4. So 3 is a nice number. And if your range is 2.4, 2.5, or 2, your doctor may not flag this or pay attention or say anything about it. And then the reverse T3, I like to look at T3 and reverse T3 together, because if this one is the active is on the low end of normal and the reverse is on the high end of normal, this is telling us that the body is trying to make more of the reverse, the inactive, the one that shuts down energy production. And then we have to ask ourselves, why is this happening? Why is the body favoring that? And then you'll see also the functional ranges. And then we have the anti-TPO, which is the autoimmune marker. A lot of times you'll find that below 35 is considered normal, but for functional levels, we want it below than 2. So what if your range is 10 or 15 or 20? That's telling us that there is some autoimmune activity, maybe not enough to tell you that you have Hashimoto's and you shouldn't diagnose yourself, but hey, there's something. The immune system is reacting to these proteins. And guess what? We can do something about it with diet and lifestyle. You don't really need a medication just yet, but it's a clue. And I want to answer a question here that I often get. If you have Hashimoto's already, should you keep doing anti-TPO and anti-TG? Because many doctors, they say, once you have an autoimmune condition, you do have an autoimmune condition. Unfortunately, it's not curable. But in the thyroid gland, you should monitor the ranges, because things that you do to improve your gut health and the stress and the exposure to toxins, it is going to affect your levels. So the degree of immune response is going to help you monitor progress. So many times people are in the thought, like if you're at 500 and now you make some changes and you drop the anti-TPO to 100, that makes a big difference. That's a step in the right direction. So I think it is important to monitor, try to get those numbers lower, as low as you can, even if you cannot get them under 35. I think it's really important. Thyroid binding globulin, it's good to have a range, because if it is too high, it can mean that thyroxine or thyroid hormone is not available for the cells. So factors that affect thyroid function. So how do we make sure that we are making enough T3 that is going to the cells and being sensed and utilized? So we need certain minerals. So iron, iodine, zinc, selenium, copper, magnesium. We need vitamins and we need amino acids, specifically tyrosine, but we also need other amino acids as well too. And then things that will help improve T4 to T3 conversion. These are selenium and zinc, and we want proper gut and liver function as well too. And then we need to improve how the cells are sensing the thyroid hormone. So we need vitamin A, zinc, and exercise will help with that. So these are all the good things that we want to promote, the positive factors. On the other side, we have the negative factors. These are the things that would reduce the production of thyroid hormones, and then will push the body to make less T3 and possibly likely more reverse T3. So if we have, and then you'll see most of these overlap on both steps. So stress, trauma, infections, whether you have the flu or Lyme disease or chronic ear infections, but also parasites, bacteria, yeast. We know now COVID, there are more and more studies on long-term COVID or long-haul COVID, and they're finding that it is affecting the immune system and the gut and inflammation and the cytokines. And so unfortunately, some people are more prone to it. And these could be people who are already compromised in the gut and the immune system. Certain medications, autoimmune conditions, fluoride and toxic load. And then in here, we talk more about this stress and trauma, infections, low calorie diet, fasting, low protein intake, low selenium. Too much iodine can be actually a problem, liver and kidney dysfunction, alcohol, and then certain medications. So any deficiency in here is going to promote this side and the negative factors that affect the thyroid. Based on this, like how does the gut affect the thyroid and how is that connection? Why is it important? So you need adequate stomach acid. So that's the number one step for digestion. And we need stomach acid to absorb the nutrients. So you see the iron and zinc and selenium and all these B vitamins, we are eating them, but we are not absorbing them. That's a problem. Then unfortunately, the food is being wasted and it's not benefiting your body the way it's supposed to. And then there are studies that found that thyroid medication absorption is reduced with low stomach acid. So here's the case where you may be taking Synthroid or levothyroxine or Armour thyroid or whatever medication, and you're not feeling better. And the missing link could be that you don't have enough stomach acid to absorb it and utilize it. And it's kind of interesting because the recommendation of the study is that doctors should prescribe higher doses of thyroid medication, up to like 30% more. And they had a guideline. But I'm like, well, what about supporting stomach acid? And what about supporting digestion and absorption, which is really, really important. And then it will help you also get the nutrients, not just the medication as well. And then we know that chronic infections, we talked about this, all these steps, is that chronic infections will lead to inflammation. And, the microbes in the gut are going to produce something called LPS. And this LPS is endotoxin. It's going to release more inflammatory. It's an inflammatory compound that will make your immune system react even more. And it will lower T3. It will dull the hormone receptors, so the cells will not see T3. It will produce more cortisol and then make more of the reverse. And this is just a sample of the stool test that I use with my patients to detect if the microbes that produce LPS are present and if they are present in high levels in the gut. And so there is a lot more information that you could be collecting about your health and about your digestive health as well too. And then 20% of the T4 to T3 conversion happens by your microbiome. Your good bacteria is also needed to do that. And so not only now we know the good bacteria, we need them to utilize and synthesize nutrients, they're also going to help us convert to T3. So, questions about, like, you may be wondering, are you absorbing properly? Stomach acid or hydrochloric acid produced in the stomach is very, very important for absorption of so many nutrients. And even when we think of anxiety and depression and mood disorders, we need the proteins to make the brain chemicals, the neurotransmitters, the serotonin and dopamine and all these feel-good hormones, and help us relax and feel alert. And protein malabsorption because of stomach acid issues are going to also affect the thyroid and stress levels as well too. So low stomach acid, what can cause that? Low zinc. So zinc is needed to make hydrochloric acid. And it's another loop where if you don't have enough zinc, you're not making enough stomach acid, but you need stomach acid to absorb the zinc. So we're trapped. We got to find a way to break the cycle. H. pylori infection will reduce stomach acid production because that's the bacteria that grows in the stomach. So if there is a lot of acidity, it's not going to survive. So what's the bacteria going to do? It is going to make you produce less acid. And that's going to be a problem for digestion. And then gastritis or infection in the stomach and the stomach lining. And then what reduces acid production, PPI and other anti-acid medications. So PPIs are proton pump inhibitors, and these are more the Nexium, the Prilosec, pantoprazole, omeprazole, these kind of family of medications. But then we have other antacid medications like Pepcid, which are the H2 blockers to a lesser degree, and then also excessive use of Tums and foods that neutralize the acid, then that's a problem because we're not absorbing properly. So the big one is PPIs. And unfortunately, Nexium is one of the top medications that are used over the counter and prescribed. And so many people don't know that this is not to be used long-term. It has long-term effects, that it promotes infections in the gut. It promotes even osteoporosis, nutrient deficiencies, pneumonia, and so C. diff infections. And so it's not meant to be for everyone to take for long-term purposes. So we must support stomach acid. And here's when I was like, wasn't sure of how much I want to share, because some of those things there can be good, but also bad for certain people or to things to do. So apple cider vinegar, in theory, is supposed to help us make more stomach acid. We can take hydrochloric acid capsules, and digestive bitters also will help us make hydrochloric acid, but they may not be the right approach for somebody with gastritis, ulcers, H. pylori, GERD, LPR. So if you have any of these digestive issues, please be careful, seek medical advice, because what happens if you have H. pylori and you take a lot of hydrochloric acid, it forces the bacteria to burrow deeper in the lining of the stomach, then it becomes harder to get rid of. So it's very, very important to not do that. Now, where does the leaky gut come in, and autoimmunity and Hashimoto's and all of those things? So we know that infections and overgrowth of the wrong types of microbes are going to lead to leaky gut. So that LPS that I told you about, that is the endotoxin that's produced by bad or inflammatory bacteria. If your gut is leaky, as you will see here, it will pass through the lining of the gut. This place on top is where food is coming in, and this is inside of your body. This is all tissue where the immune cells and system is residing. And if anything foreign comes in here, specifically the LPS, that's going to trigger inflammatory response. And that's when autoimmunity is going to happen, inflammation, and food sensitivities as well too. So when we know Hashimoto's is common and on the rise, we need to make sure that we're addressing this, and not only for Hashimoto's, for all other autoimmune conditions. And that's where a lot of the doctors who specialize at the receiving end of the autoimmune attack, they're not really looking at the gut and asking those questions or helping patients really address autoimmunity from the root cause. A little bit about food sensitivities. Food sensitivities don't actually cause thyroid problems directly, but they do increase inflammation. And this is a sample of a test from one of my patients. And so if your body now is confused and it's creating a lot of inflammatory responses, as we've seen here, it is going to start reacting to food. So it will lose the tolerance to food. We call this oral tolerance loss. And then thinks basil is a problem, or it may think that chicken is a problem, and things that we wouldn't normally think of as problematic. And then the food sensitivity response will lead to more inflammation, which will lead to more stress on the thyroid, and the brain fog and the aches and pains and the bloating. Well, how much of it is thyroid directly and how much of it is related to food sensitivity? It can be both happening at the same time. So we talked about how the gut affects the thyroid. Now let's talk about how the thyroid affects the gut. Hypothyroidism is going to lead to reduced gut motility and reduced gallbladder function. So everything's slow. The muscles are not working properly. The gallbladder is not releasing bile to absorb and to digest and absorb nutrients. So that will result in constipation, reduced digestion. Then you're not digesting the food, the bacteria is going to feast on it. And then that can lead to SIBO, which stands for small intestine bacterial overgrowth, dysbiosis, which is a shift between good and bad bacteria, and leaky gut. So how will that make you feel? You may feel dyspepsia or chest pain, indigestion, bloating, gas, constipation, and sometimes also diarrhea, although we tend to see hypothyroid related to constipation. And we find that there's a connection here, there's stomach acid connection. So which one came first? We don't know, but the low acid will lead to low B12, low iron, different kinds of anemias, low vitamin D and other nutrients. So if you keep taking supplements and you're not getting better, and the levels are not improving, that's a sign that your thyroid the gut is not working properly. Sometimes it's hard to tell which one came first. Oftentimes it's the thyroid slowing down causes digestive issues. And but we have to work on both the gut and the thyroid to optimize thyroid health and also fix the underlying gut issues in order to really get the results that we want, which is more energy, better gut health, better digestion, and not having constipation or diarrhea. What are we going to do about food and nutrition? I tried to summarize the main ones, and I will go into detail with each one of those. So the first thing is we need to manage blood sugar and balance that. We need to eat enough calories, protein, carbs, and healthy fats. And I'll talk more about this. We need a lot of nutrients in the diet. We need fiber and probiotic foods. And I'm going to share a few foods to reduce, and then we'll talk about autoimmune considerations. So what are we going to do to balance blood sugar? So blood sugar is really important because fluctuations in blood sugar are going to affect insulin and cortisol. And both of those are going to be stressful in the thyroid and also the adrenal gland. And I don't have a chance to talk about the adrenal today, but if the adrenal is sluggish, is also going to affect the thyroid as well too. So we have to balance blood sugar, and we just don't really want those spikes. This is going to be really important. So we want to avoid extremes pretty much. So we want to cut out sweets. I know that's easier said than done. It doesn't mean never ever have a piece of dessert, but it just means that we need to be able to function on a daily basis and not be attached to the dessert or the sweet. But we don't want to go completely keto diet or super duper low carbohydrate, because that's also stressful for the body. So when it comes to the thyroid, balance and moderation is going to be really, really important. And I know this can be a bit tricky if you are trying to lose weight because of you have hypothyroidism, and it's really already harder for you to lose weight. And so you might think that you're going to grind and you're going to push and you're going to do this most amazing diet with maybe intermittent fasting, and which I think it's a great thing for the right people in the right time. But you just have to be careful, especially in the beginning, while you need to allow your body time to heal and recover. So what do we do to balance blood sugar? We want to pair the carbohydrates with fat and protein. So if you're going to eat a piece of fruit, have it with some almond butter or peanut butter, or avocado with toast, or having some olives with the cracker, for example. Like, these are not the best examples, but just to give you an idea, if you're going to have maybe some pasta, make sure there are lots of non-starchy vegetables and some fish or chicken or steak that goes with it. And so that's how we balance this. And we want to eat every 3 to 4 hours. I like 4 hours because it actually helps reset the gut, but you have to sense how that makes you feel, because if you go for a long period of time without eating and then you end up overeating, then that's a problem as well too, and it will cause your blood sugar to spike. And here's a little trick, is that you try to push the carbohydrates towards the end of your meal. And there are some studies finding that if you just eat the vegetables and the non-starchy vegetables and the protein first, and then finish the meal with the carbs, it actually, the blood sugar doesn't spike up as much. It actually is more balanced. So I'll give you an example. Start with a salad, or maybe like a vegetable soup made with zucchini and bell pepper and celery and carrots, and then have the chicken and then have the potato. Now, it doesn't mean you can't sneak a bite of the potato earlier, but just to give you the example, like while you're eating, just look at your plate and do this little swap. And it can actually help. Healthier carbohydrate options. So this is going to depend on your gut and digestive tolerance. And I know this is a bit tricky, because if you have SIBO or bloating or gas, you'll be like, I cannot eat any of these foods. And so that's why it's really important to look at the underlying root causes and address these, so that you can eat those healthier carbohydrate options. So we want the legumes, which are high in fiber and protein. So lentils and chickpeas and other types of beans. We want fruit. When we think of fruit, fruit is not bad. I think we just have to think of it as moderation. And we have to be smart about the fruits that we choose and pair them with fats and protein. So berries are going to give you the best option because they are low in glycemic index and they're high in antioxidants. Apples, pears, pomegranate is another one, but also red grapes with the skin, and cranberry, all high in antioxidants, and there's room to fit those in an overall healthy diet. Winter squashes and root vegetables are going to have vitamins, minerals, fiber. So we're talking about sweet potatoes and turnips and parsnips and beets and things like that. Grains, we're going to choose whole grains. Now, sometimes grains get a bad rep. I think they can be okay in the diet, and they can be used in moderation, and especially good source of fiber. They're not all bad that, sometimes you may see in some websites or some diets. We may have to reduce gluten grains or remove them completely if there are autoimmune issues. And I'm really a big proponent of figuring out what works for you, whether it's testing and experiments, and then doing what feels right for your body. I think that's really, really important. So it's important to get adequate proteins. So just to go back to what the thyroid hormone is doing anyways, it is the T3, when it binds to the receptor, it's telling the cells, hey, make more proteins, make more enzymes, let's turn things on, it's excited. So the cells need to have a pool of amino acids to make these proteins. If we don't have amino acids to make these proteins, what's going to happen? So the body could possibly get the proteins, the amino acids, from other places, from the muscles and connective tissue. So you may start to lose muscle weight. Are you taking more medication, but then you're feeling weaker? You're not building on muscle tone, even though you're exercising, or you have more joint and ligament pain. So that could be a problem. And then if there aren't enough proteins and amino acids, to make the proteins, the brain might send the message and say, you know what, let's just stop things down. We don't have the building blocks. What's the point? So that can cause things to slow down. And we need protein, obviously, to balance blood sugar. So that's really important. Now, how do you assess your protein level? If you have a CMP, so this is the panel that contains glucose, sodium, and potassium, take a look at your total protein. It's not always easy in a direct picture, but ideally we want it between 7 and 7.3. And here are the ranges for albumin and globulin. If it is lower than that, then possibly you have a protein malnutrition. You're not getting enough, you're not eating enough, or you're not utilizing that from the diet. So who is at risk for protein deficiency? People who are vegan or vegetarian, and this is not a blank statement. This is if somebody is vegan or vegetarian and they're not being careful and they are not eating a high protein vegan or vegetarian diet. So you can be vegetarian and eat lots of protein rich foods and be good to go, but then you can also eat a lot of cereals and breads and crackers that are low in protein. So that's just important to be aware of this. Elderly people are at risk because as we age, we don't produce enough stomach acid. So we don't absorb as many amino acids from our food. Chronic dieters, so if you're chronically dieting and limiting how much you eat, including protein, but also energy. If you are on a low calorie diet, the body will take the protein that you're eating from chicken or tuna or whatever, and it's going to utilize it for energy. So it's going to leave your amino acid pool deficient. People with low stomach acid issues, if you are using PPI, especially chronic, low zinc level, and have H. pylori infection. And then I'll say here, people who graze often. If you're always grazing, you're having a cup of coffee with crackers or with a pastry, and you're snacking maybe on a handful of almonds or peanuts, and they do have protein, but maybe not enough. And then you're going all your day, you're running your errands, taking care of your kids, you're on the go, moms also, and then you're not sitting down to eat a meal. And I think it's really, really important that we sit down and have a breakfast or a lunch, even snack. Make sure that you are actually mindful of the protein in it. We do want to have maybe eggs, or if you're having oatmeal, are you adding the seeds and the nuts that have enough protein? If we're making a smoothie, are we incorporating enough protein in it? And there are lots of details, obviously, in different products to use. Now, selenium is really important and protects the thyroid gland from oxidative damage. But it's very, very important to have enough selenium if you're taking iodine supplements, because iodine is going to create free radicals and oxidative damage. So the selenium will curb that. And then we recommended 200 micrograms per day. So a lot of supplements have this, or not a lot of multi. If you are taking a multi, take a look at how much selenium. The one I recommend for my patients always has 200 micrograms. I just want you to be aware of Brazil nuts. Brazil nuts, like any natural food, we don't know exactly how much selenium in each one. And so you could have 55 micrograms and 550 micrograms. So if you eat 4 per day, it could be 200, but it could also be 1,000 or 2,000. We don't know. So the upper limit of selenium is 900. And I've had patients report numbness in their hands when they were eating a lot of Brazil nuts, and like I think it was a combination of the selenium from the supplement and Brazil nuts. So just be a little careful, start slowly, 1 or 2, and then see how that goes. Iron is important for the function of TPO, and unfortunately, low stomach acid is going to affect iron levels. And so we're going to get most iron from animal proteins. They're more bioavailable, but we're also can get iron from from plant foods as well too. Now, don't go take an iron capsule or supplement just yet. It's really, really important to test because iron is toxic and will increase oxidative damage. So women who are menstruating, losing blood are more likely to have iron deficiency, but it's not the case for everyone. So the doctor may do, they may do a CBC, which includes hemoglobin and hematocrit. I really, really highlight ferritin. And I forgot to put the range here, but we want ferritin to be more than 40 to 80 is really ideal. And ferritin is the iron stores. And so the savings account is really low when the ferritin is low. Now, zinc is also needed for the production of T4, the conversion, and the sensitivity to T3. And again, it's another one of those nutrients that is going to be reduced with low stomach acid. And here are the sources. So you can see a pattern that we need the gut to work. We need the stomach to produce enzymes and help us absorb the food in order to get the nutrients that we need. Now, iodine is needed for TPO to make T4, and iodine is going to be found in sea plants. And iodine levels, if they're low, they will lead to goiter, which is enlarged thyroid. And so if you don't have enough iodine, you will not be able to make T4. With iodine, it's a bit tricky. So if you are using Himalayan salt or sea salt, you are probably not going to get iodine from the salt. And the iodization of salt helped reduce a lot of iodine deficiencies, but it's not perfect because yes, you're getting iodine, but iodized salt is typically tend to be very heavy in chemicals. So personally, I still use it. I kind of alternate between the Himalayan and the sea salt and the iodized salt. So I just make sure I get a good variety of all these different types of salts. But I also like to recommend and incorporate kelp seasoning, and you'll find this in most grocery stores. It actually doesn't really have a lot of flavor. For me, it's like oregano. And then I would add it to roasted vegetables or scrambled eggs or something like that. And that's going to be a good source of iodine. And then with iodine, excessive bromine and chlorine and fluoride is going to be a problem, which is too much to go over right now. Now, just be careful with iodine. If you're going to incorporate a multi with a little bit of iodine, here's the range, 150 micrograms, that's okay. But then there are people who are trying and promoting higher iodine levels or even more iodine use. And I think we have to tread carefully here because too much iodine can cause oxidative damage. So if you don't have selenium and you take a lot of iodine, you're creating a worse scenario. And people with Hashimoto's and hyperthyroidism, they may actually not do well with iodine. So you may add this kelp seasoning and you feel worse, or you have a seaweed salad and you feel more hyperactive, more anxious, diarrhea, headache, any of these issues, then that's a sign that it's not for you. So there are two schools of thought. Dr. Brownstein thinks iodine is safe. Dr. Karazian thinks to avoid, you're adding fuel to the fire. So I think this is where it's important to know your body and work with someone who knows how to do this. Now, probiotics and prebiotics. Prebiotics are the foods for the bacteria. So these are all the fibers that we need to eat to feed the good bacteria. And then the probiotics are the live culture. So they come in yogurt, aged cheese, fermented vegetables. Now, supplements are very helpful. And I always tell people that, you want to test before you take probiotics, but I know many of you will buy your own probiotics and try that, which is okay. So I put the probiotic that I recommend, and then I have a full article on how to use it. Because I know if you're going to go buy a probiotic anyways, I'm going to tell you which one I recommend. So you can read from there and order from the links in that page. So goitrogens are food that cause the block iodine and interfere with TPO and reduce TSH. So they may give you that feeling of tightness in the throat, coughing, hoarseness, difficulty breathing, and swallowing. So when they will cause the thyroid to expand because it's trying to get more iodine, and so it will swell. Now, unfortunately, the foods that contain goitrogens are a lot of the healthy ones. So specifically the cruciferous vegetables, and people will are concerned. Can I eat broccoli? Can I eat cabbage? I heard that they are bad for my thyroid. What should I do? Oh my, like, this is very stressful because we're getting all these mixed messages. So what do we do with goitrogens? Here's what my recommendation and my approach is, that you want to cook them, because cooking them reduces their goitrogenic effect. Except for soy, if you cook it, it doesn't actually do that. So I would like people to avoid soy, to be on the safe side. But things like broccoli or cabbage or cauliflower, blanch it, or even spinach, leafy greens, saute with a little bit of olive oil, a little bit of blanching, a little bit of steaming. That would make them less goitrogenic and actually easier to digest and more bioavailable for nutrients. And we want to avoid excessive intake. So here is for everyone who's doing a daily spinach and kale and strawberry smoothie. That may not be that great for you. So everyone touting the green smoothies every single day, there's also oxalate problem, but also may not be that great for the thyroid. So just be careful with that. We want variety, and we want to get enough iodine and selenium, because these are a problem if you don't have enough iodine and selenium. And if you're still not feeling better, then you could remove them. But I wouldn't start with that because they offer a lot of antioxidants. And then when it comes to the immune health, and I know this is now becoming a lot to discuss, gluten and dairy are common triggers. The paleo diet or something similar to that, where you take all grains and all legumes, have been, recommended for people with autoimmune conditions. My approach is that I like to fix the problem. I don't want to restrict more than necessary. I'd like to have rice also, and I'd like to be able to have chickpeas and lentils. And I would like to not be overly restricted or restrict my patients when I can. So I like to address food sensitivities on individual basis, and then see how the person is responding and look at underlying gut problems, leaky gut infections. Can we fix all of this? And maybe for long-term maintenance, you don't have to be on something like paleo or AIP diet. With gluten and dairy, I think it's really tricky. I had a question like, do I always have to remove gluten if I have Hashimoto's? I think it's important to do that in the beginning, as you are addressing the underlying gut problems and the leaky gut. We take gluten and we take dairy, and then you check your antibodies, the anti-TPO and anti-TG, and then once you reach a level that is low and healthy for you, maybe not completely gone, then maybe you can try to introduce a little bit of gluten for a few months and then see what happens, and if that causes the antibodies to spike up. So I think we can't just go by signs and symptoms of adding or removing gluten. Even gluten-free products are not always 100% gluten-free. And so that needs a little bit of dialing and working with someone to just know the details. But I think in general, for anybody watching, I would say eliminating gluten is very important for Hashimoto's. So we want to eat organic when we can, grass-fed meats and organic pasture chicken and eggs when we can. We want to use healthier oils because vegetable oils are actually going to create inflammation. So corn oil and cottonseed and soybean, we want to replace with these oils lots of antioxidants, healthy essential fatty acids like omega-3s, and then adrenal detox and sleep support, obviously individualized as well too. And for the gut, we want to make sure we have adequate stomach acid. If we have food sensitivities, we have to make sure that we are uncovering those, addressing those. We want to know, do you have overgrowth of bacteria, yeast, parasites, SIBO, and overcome these as well. We want to heal and repair the gut, make sure we have good, healthy gut flora. And with celiac disease, there is inflammation, a lot of inflammation happening. So we have to repair the gut lining. And then if you have long-term constipation, the constipation can be caused by SIBO or the parasites or the yeast or low stomach acid. So we need to have a long-term solution to that. It could be related to stress, of course, and nervous system issues. Making sure you have a daily bowel movement that goes smooth and easy is very important to the core of your health. And then I do have other labs that we can assess blood sugar, celiac disease screening, fasting glucose, fasting insulin, and hemoglobin A1C. We can look at food sensitivities, chronic inflammation, and others. And I think it's important to not get overwhelmed, that you start with the basics, with what your doctor can help you with, and then you add to it as well too. And then the stress and the environment. We know that all types of stressors, whether it's mental, emotional, physical, trauma, blood sugar fluctuations, even lack of sleep, or exercising a lot or environmental allergens and pesticides. I mean, these are all infections. These are all going to create stress in the body. And it's telling your thyroid, I need to preserve energy. The thyroid ultimately is trying to protect you. You don't like the side effects of it, but it's trying to protect you when it's slowing things down. Again, the stress increases cortisol levels, so it affects many aspects of the thyroid gland. So thyroid health is not just one lab or one pill. It's not just about taking Synthroid and assuming it's going to do magic. There are other types of medications that will give you T3, T4 combinations, more natural medications that more mimic what your body's supposed to be doing. There are a variety of options, and monitoring is not just by just TSH. You really have to look at the full picture. We have to address autoimmunity because the thyroid is connected to cardiovascular disease, miscarriages, fertility issues, osteoporosis, and women are at a higher risk for developing thyroid issues. And so it's really important to be advocates for our own health and for the men also too. But unfortunately, women tend to be more prone for thyroid conditions. So if you're watching this, hope this was really helpful. I want this to give you the information that you need. I wish for you to be able to take all that we talked about and go look at your own labs and have conversations with your doctor about what needs to be done to improve your health. But if you're still taking your medication or you're being told that you're fine, you don't have anything, there could be more to it and more layers underneath that. So if you want my help with digestive issues, food sensitivities, if you know there's something in your gut, you're just not able to pinpoint it and put your fingers on it, and you need more help and support, I'd love to hear from you. And I offer a strategy session or an assessment session in order to see where you're at with your health and if it's a good fit to work with me, and then we can decide on what is best for you. So I run food sensitivity testing. Here's a sample of that, and you can see like symptoms of food sensitivities are going to be all over the body, and they do mimic a lot of thyroid issues, insomnia, brain fog, anxiety and depression, and weight loss, weight gain. So very related. And then we run stool testing. We want to know what's in the gut. What are all these inflammatory compounds or microbes in our body doing? And do we have SIBO? What is digestion looking like? And these are from 2 different patients, and each one will need a different digestive support, detoxification as well too. So there are more layers, there are more data, and each person is different. So if your friend does something, it doesn't mean it's going to work for you. And then both are connected, the gut and the thyroid. So we might not know which one started first, but we have to address both at the same time. Medications are okay if they're working, but if you're taking the medication, it's not working, there's more that you got to understand and learn about your body. Because ultimately, if you're taking a medication and feeling your best, that's great. But if you're still have brittle hair, losing your hair, your nails don't look good, you have brain fog, body aches, and you have a bowel movements once every 3 days, that's not healthy, that's not right, it's not working. Have a couple of questions that seem to be personal, so it's going to be hard for me to answer them. If you have any questions, I'm going to send this as a recording. If you have any questions, just respond to the email and we'll do our best to track the questions. Thank you so much, Linda, and everyone who's here with me today. That's it. Thank you for sticking around. So I hope everyone has a great day today.